Good afternoon, everyone, and welcome to the third live session of Kidney Action Week today. On behalf of American Kidney Fund, I hope you're having a great day learning about kidney disease and also being able to connect with others. I'm Melanie Paris, and I'm Senior Director of Education and Strategic Outreach here at American Kidney Fund. I am excited to serve as your moderator for this session today. Because we have just great speakers for you and a lot of information that I'm sure you'll find valuable as a patient, caregiver, even a provider. This session is about high blood pressure and stage 3 kidney disease, and we always get a lot of questions about this topic. So I hope with this session you'll be able to gain a better understanding or more information that perhaps you didn't know about the interplay between chronic kidney disease and high blood pressure, and also have a chance to answer any questions you may have of our wonderful panelists today that I'm happy to introduce to you now. Our two panelists, Dr. Yoshio Hall and Kathy Wong, have joined us today, and we're really happy to have them and their expertise available to all of us today. First, I'd like to introduce Dr. Hall. Dr. Yoshio Hall is Professor of Medicine at the University of Washington and Chief of Nephrology at the VA Puget Sound Healthcare System, where he provides care to patients with advanced chronic kidney disease. He is a former AKF board member as well as a recipient of the American Kidney Fund Clinical Scientist in Nephrology Fellowship. As a core investigator and epidemiologist at the Kidney Research Institute, Dr. Hall has studied the healthcare structure, utilization, and outcomes of people living with chronic kidney diseases who are from low-income or vulnerable populations. So thank you very much for joining us, Dr. Hall.
Thank you so much for having me.
Next on our panel, we have Kathy Wong. Kathy Wong is a registered dietitian for DaVita Kidney Care. She works with hemodialysis patients. She's also provided education to kidney disease patients prior to starting dialysis and how to optimize health by collaborating with their healthcare team and treatment modalities that are available to them. Kathy is also a member of American Kidney Fund's Dietitian Advisory Committee that helps us design different education materials for people who want to learn how to eat better with kidney disease. So thank you so much, Kathy.
Thank you.
So I encourage everyone in our audience to join the conversation wherever you may be logging on today. We'll have overview from our panelists, and then after that, we'll be able to open up the floor to our audience to ask any questions that you may have. You can drop your comments or questions in the window next to or below the Facebook live stream or in the chat box to the right if you are here with us on the Kidney Action Week website. We'll try to answer as many questions as possible, so I hope to get to everybody before the session ends. So let's just get started. So just to give you an introduction, according to the CDC, nearly half of adults in the United States have high blood pressure, and it's also one of the leading causes of kidney disease, the second leading cause, in fact. So Dr. Hall, question for you. Can you please explain what having high blood pressure means and why and how is it connected to kidney disease?
Sure. So maybe we can have the first slide up, please. And so it's a great question, Melanie. So what is high blood pressure? Blood pressure is probably something that I think most people who are joining us today have had measured in their lifetime at least once. It's probably the most common measurement that we take in medicine. But what exactly is it? Well, it's actually defined as the force or the pressure of the blood on the arterial walls. And so arteries are these kind of muscular blood vessels that take blood away from the heart to the vital organ of the body. And we have really two readings for blood pressure. And so the first is the systolic blood pressure, which is the force that the blood exerts, the pressure that the blood exerts on the arterial walls when the heart pumps, and that's what we call systolic blood pressure. It's the higher of the two numbers. And then the second number is called diastolic blood pressure. And as many of you are surmising, this is the pressure of the blood on the arterial walls when the heart relaxes, and so during diastole. And this is typically the lower of the two numbers. Next slide, please. And so since 2017, we've had a revision of the blood pressure categories. And so, this is from our colleagues at the AHA and the American Stroke Association. But now normal blood pressure is still considered less than 120 systolic and 80 diastolic. Elevated blood pressure, which is, you can see there in yellow, is now between 120 to 129 systolic, so when the heart is pumping, and a normal diastolic blood pressure, so less than 80, and this is measured in millimeters of mercury. And this is new since 2017, but high blood pressure or stage 1 hypertension is now defined as a blood pressure, a systolic blood pressure of greater than or equal to 130 and less than 140, or a diastolic blood pressure of greater than or equal to 80 but less than 90. Stage 2 hypertension, which you can see in kind of that lighter shade of red, is a systolic blood pressure of 140 or higher, or a diastolic blood pressure of 90 or higher. Blood pressure, both of these numbers will tend to go up in tandem. And then what we call hypertensive crisis, which is something that needs to be addressed more urgently, is a blood pressure, a systolic blood pressure of greater than 180 and or a diastolic blood pressure higher than 120. And again, this usually requires more urgent attention. Next slide, please. So one of the reasons why blood pressure is called the silent killer is that most people with high blood pressure have absolutely no symptoms, and they may not have symptoms for years. And high blood pressure not only causes the heart to work harder, but it can exert excessive pressure on a number of end organs and essentially injure or cause damage to almost every organ system in the body. For those people who do have symptoms, the most common symptoms will tend to be headache, fatigue, vision changes, nausea, and we often refer to that particularly if the blood pressure is in the hypertensive crisis area, hypertensive emergency, because that is evidence of end organ injury or damage. Next slide, please. And so as Melanie mentioned, if you have hypertension, you are definitely not alone. The Center for Disease Control and Prevention in the United States estimates that there are essentially 1 in 2 adults in the United States have hypertension, or about 116 million people, but only about a quarter of them have their blood pressure or their hypertension controlled to an adequate level. And this comes at tremendous cost, not only to the individual in terms of what we call morbidity, mortality, but also to society in general, to the tune of about $130 billion plus per year. Next slide, please. And as I mentioned, uncontrolled blood pressure for long periods of time can go undetected, and if allowed to remain uncontrolled, can essentially result in end organ damage to almost any organ system in the body. The most commonly feared ones are probably stroke and heart disease, but chronic kidney disease. Hypertension is the #2 cause of chronic kidney disease in the United States and in most high-income nations. You can have visual changes, which can be catastrophic to an individual's quality of life, as well as damage to your reproductive organs, compromised pregnancies, etc. Fortunately, though, high blood pressure can be easily detected. Next slide, please. And so what about chronic kidney disease? And so most people in the United States have 2 kidneys, and the adult kidneys are roughly about the size of your fists. We sort of grade kidney disease on a scale of 1 to 5. And this is based on what we call the Egfr, which is an estimated glomerular filtration rate, or put into more sort of comprehensible language, basically is the kidney's ability to filter waste. So stage 1 and 2 chronic kidney disease essentially are very mild forms of the disease. Often the kidneys are either minimally or very mildly impacted in terms of their ability to filter waste, but you may have some other abnormalities which your care team has picked up, such as having a little bit of excess protein in the urine. You could have some blood in the urine, which is coming from your kidneys, which may persist over time. Cysts are very commonly observed, recurrent kidney stones, for example. However, most people who have been told that they have chronic kidney disease typically have stage 3 or higher. And so in stage 3, we have an earlier stage of stage 3, which is stage 3A, and then a more advanced stage, which is referred to as stage 3B. In stage 3A, as you can see, the Egfr, or the kidney's ability to secrete waste, is between 45 to 59, and we measure this in milliliters per minute, but many people, and I think it's very reasonable to consider this as a percent kidney function. Typically, this means that your care team has detected some abnormalities in the filtering ability of your kidneys. Stage 3B is more advanced, where your kidney function is between 30 to 44, and we would consider this moderate to moderately severe kidney disease. Fortunately, stage 4 and stage 5 are far less common, but are much more advanced. Stage 4 means that your kidney function, or your kidney's ability to excrete waste, is between 15 to 29. And stage 5 means that the kidney function has dropped below 15. And then what we call end-stage kidney disease is defined as the need for either dialysis or a kidney transplant to sustain your life. And so the Center for Disease Control estimates that approximately 37 million people in the United States, or about 1 in 7 U.S. adults, have chronic kidney disease. Fortunately, most of the people with chronic kidney disease have earlier stages of the disease. And the 2 most common causes of chronic kidney disease are diabetes, number 1, and hypertension, number 2. Next slide, please. So there are a number of options for kidney disease testing, and these options are typically available at almost any clinic, at any medical clinic. Sometimes you will commonly see your serum creatinine, which is a very, as I mentioned, common blood test. It's really, creatinine is a waste product of muscle, and healthy kidneys are essentially able to secrete or eliminate creatinine into the urine. And so we know, based on elevations in your serum creatinine levels, that your kidneys may not be functioning at, for example, 100%. And then we use that value of the serum creatinine to estimate your glomerular filtration rate, and that's what you'll often see as your Egfr. And this is a calculated value. It's an estimate in which we take your serum creatinine, so the amount of muscle waste product in your blood, and we put it into a formula that takes into consideration your age and your sex to produce this number called the Egfr. Next slide, please. And so just in summary, before I move on to my colleague, Kathy Wong, that blood pressure and hypertension is actually very, very common. So if you have hypertension, you're definitely not alone. As we mentioned, approximately half of American adults have hypertension, but only about a quarter of them have that controlled. And so uncontrolled hypertension over a period of time can cause not only heart disease and stroke, but it can cause the arteries to the kidneys to weaken. They will become thickened, and the amount of blood that is reaching the kidneys will decline or decrease. and this will result in further kidney injury, kidney damage, kidney scarring, and this becomes actually a vicious cycle because the kidneys are very integral, not only in kind of cleaning out or filtering the waste in your blood, but also in controlling blood pressure and blood volume. And so as you can imagine, the more damage that you have to your kidneys, the more difficult it actually becomes to control your blood pressure. And sometimes you may develop swelling, other conditions that are associated with this. But fortunately, most of these things can be either prevented or treated. And Kathy's going to talk a little bit about really what I consider the fundamental step in preventing and in treating both hypertension and one of the major causes of chronic kidney disease in the United States and other high-income nations, which is foundationally based on your dietary intake. Thank you.
Thank you so much for that overview, Dr. Hall. It was just very helpful to set the tone and for people to be reminded of high blood pressure and how it all connects to the kidneys. So, as you know, managing what you eat is just critical, especially when you're at stage 3. Kathy Wong, can you discuss the role of a renal dietitian and why eating in managing your kidney diseases is connected and why it's so important, especially if you have stage 3 with high blood pressure?
Yeah. So to start off, registered dietitians are qualified or licensed healthcare professionals who have the scope of practice to translate information, scientific information, into more practical solutions or ways that we can follow in real life, such as diet recommendations. And that's so that it can address certain disease states and any healthcare goals that you might have. Now, this is different from someone who call themselves just a nutritionist, as they don't have the necessary qualifications or license. So technically, they're legally only allowed to educate on the general diet for the general population. So I mentioned that because there's so much out there online. And so it's important to be mindful of the sources that you're getting information from. Specifically for renal dietitians, we help you navigate your labs, decipher what diet recommendations truly fit your individual needs based on your kidney function. The most important thing is to prolong the health of your kidneys and to prevent the progression of the kidney disease. So we can't reverse the disease, the damage that has been done, but studies have shown, just as Dr. Hall has mentioned, there's significant evidence stating that how effective diet management is to prolong the health of your kidneys. And so, touching on diet, people commonly express feeling defeated by their health conditions. And so I hope one takeaway from this session is that you can feel more empowered by the fact that you can still regain some control over your health, especially through just a simple act of putting something into your mouth. As mentioned, hypertension is one of the leading causes of kidney disease. And so for this reason, diet recommendations to manage or to control the hypertension or high blood pressure can in turn delay the progression of the kidney disease. But it's always best to talk to your doctor or your registered dietitian before starting any kind of diet, including this one that we're going to talk about, as general diet recommendations are not always, they don't always fit your specific needs. So as you can see on the slide, the DASH diet stands for Dietary Approaches to Stop Hypertension. And it's an intentional choice to eat foods that are such as fruits, vegetables, dairy products that are low in fat, whole grains, fish, poultry, beans, seeds, and nuts. It is also encouraged for people to consume less salt, low in added sugars, low in red meats, and also lower in fat. If you already have chronic kidney disease or on dialysis, some of the foods that are encouraged in the DASH diet may need some modification to address your specific needs, depending on your blood test readings. So the recommendations within the DASH diet that are particularly helpful are to limit salt, limit saturated fat, and to limit sugar. Let's be honest, a lot of these things are in a ton of foods that we normally encounter on a day-to-day basis. And so the key isn't to think about how we can completely cut them out or to stay away from them for the rest of our lives. I hope that we can take on a different mindset and to think of it as more of a lifestyle change, to take on a different set of glasses or eyes in terms of whenever we look at our foods, entering into a journey and seeing our daily plate or bowl or however we choose to eat, to be more intentional with the choices that the foods that we make. And so it can seem hard, but I hope perhaps you can kind of muster up a little desire. Even a small change can make a big difference, because if you think about it, consider every single item that we put into our body having the power to make a positive or negative effect on your health. And so any small change or small step can make an impact, whether big or small. And so don't feel discouraged if you feel like you can only muster up a little bit of change, or I can only do this much for now. That's okay. Commit to that. And also let your doctor or your dietitian know, because then they can walk alongside you on your journey towards regaining some of this control of your health again. And so next up, I'm going to talk about some suggestions you can consider related to the DASH diet. As you can see in the pictures, those are some examples of perhaps some of the things that you can think of when or consider eating when trying to make these small changes. So for one thing, be mindful of food labels. The nutrition facts label, usually on the back of food items, can empower you to become an informed consumer. They are your guide to what's inside your food, especially in processed and packaged foods. The next thing, as I mentioned earlier, salt, sodium. The DASH diet encourages us to limit our sodium or salt intake to no more than 2,300 milligrams per day. That's about a teaspoon. So if you were to scoop out a teaspoon of salt, rest it on the table, and just allot yourself that amount for each day, it's not a whole lot, but it's to help with bringing down the blood pressure. And so some tips for that include looking for items at the store that are listed as unsalted or no added salt. Another way is to remove salt shakers or soy sauce bottles from your dining table, whether it be at home or at the restaurant, just out of sight, out of mind, hopefully. And then also another tip can be just preparing more foods at home, eating at home more, because you have more control over what you put into your food rather than when you are to go out. There's less control there. Not to say that there isn't. The next thing is fat. We also touched on fat earlier. And so saturated fat are found in foods such as most animal products. So beef, pork, poultry, full fat dairy products, and also certain oils such as coconut oil and palm oil. Why focus on saturated fat? The reason is because the saturated fat we eat is made into cholesterol by our liver. Therefore, eating too much saturated fat can raise our cholesterol levels. Our body needs a certain amount of cholesterol, but any extra will build up on the walls of our arteries. So if you remember what Dr. Hall mentioned, our arteries are linked to our blood pressure. And so when the walls of our arteries start to narrow because of this buildup, in turn, it affects our blood flow. And so it can increase our blood pressure as well as our risk for heart disease and the worsening of our kidney disease. So one tip can be, if you're thinking about protein, well, I eat most of my protein from animal products. Well, you can probably consider plant-based proteins such as beans, lentils, or tofu. Those are much lower in saturated fat. Actually, they probably don't have any because they're plant-based. So all in all, work with your registered dietitian and your doctor in setting goals that are realistic for you. It's okay to let him or her know that you're not ready for certain changes, because then you can explore together what are things that you are ready to do. And if you don't already have a registered dietitian, again, you can let your doctor know and they can refer you to one. Or you can even look up on the eatright.org website to find a dietitian in your area that specializes in renal nutrition.
Very insightful. Just all the smaller things that maybe we don't think about, where sodium is hidden in the foods that we eat and seasonings and things like that. So that was very, very helpful, I'm sure. So just thinking about working with a dietitian. So you're recommending talk to your doctor about getting a referral somewhere. Any other ways that you can find a dietitian on your own and making sure that they're certified?
Yeah, so the eatright.org website, you can search by where you live and the specialty of the dietitian that you're looking for.
Great, thank you. So if you're just joining us in this session on stage 3 kidney disease and high blood pressure, a reminder, at the end of our panel discussion, you'll have the opportunity to ask questions, but you don't have to wait until the end of the panel discussion to submit your questions. We'll be on hold, and hopefully we'll be able to get to all of the questions that we have. Again, you can drop your comments in the window next to or below the Facebook live stream, or in the chat box if you're here with us on the Kidney Fund website. So we'll try to get to as many as possible. But before we get to questions, Dr. Hall, question to you. Can you discuss the recommended treatment options for managing stage 3 kidney disease and high blood pressure? Are there any new treatments on the horizon?
Sure, and maybe we can just go to the first slide. And this is a very common question, I think, that I get from my patients, which is, so what do we do now? What can we do to treat blood pressure, particularly in patients with chronic kidney disease? And so, one of the foundational approach is really what you're doing every day. Kathy mentioned paying attention to your diet, but there are a number of other things that you can also incorporate into your daily lives. One of the big things that I recommend is 30 minutes at least of exercise on most days of the week. And, my favorite exercise is walking. It's available right outside your door. Sometimes it's available right in your home if you're fortunate enough to have a treadmill or a stationary bicycle. It is inexpensive, and for the most part, there are additional benefits beyond just blood pressure and preventing progression of kidney disease in terms of both physical and mental health. I would say if you smoke, you should stop smoking. It's one of the most impactful things you can do to build your health and also to prolong your life. There's some medications, and medications, poisons, toxins, they're essentially all the same thing. They're just sort of given with different intents. And in particular, the non-steroidal anti-inflammatory medications such as ibuprofen, naproxen, Aleve, Advil. These are medications which we use for general aches and pains, but which can have detrimental effects on blood pressure and your kidneys. I would say the most important thing probably, though, is to know your numbers. Not only know your kidneys, but also check your blood pressure. If you can get a home blood pressure monitor, get one. There are many high-quality ones that are widely available either on Amazon, online. They're commonly available at places like Walmart, and you can get a very, very high-quality one for between $30 to $40. And then keep a log and communicate the readings of that log with your medical care team. Obviously, understanding the risks of long-term blood pressure on your kidneys and on other organ systems in your body, like your brain and your heart, is very important. But the changes that you make in your daily life are going to be the ones that are most impactful. I mean, you may come and see, a kidney dietitian once or twice over the course of a year. You may come and see me, once or twice over the course of the year. And so really, your daily lives and incorporating a lot of these healthy habits into your daily lives is really what I would consider the foundational approach to treating high blood pressure and really treating almost any type of chronic illness. Next slide, please.
Thank you very much for that overview. So thinking about eating, Ms. Wong, people don't always eat at home. They don't always feel like cooking. Maybe some people don't, feel that great about cooking, or they just want to enjoy some social time with friends. What do you recommend for managing your kidney disease and your eating when you're eating at restaurants? And that could be if you're dining in a restaurant or a takeout or any kind of form of eating out.
That's a good question. Going back to what I had mentioned before, the focus of the DASH diet is to limit the high-fat foods. And so if you were to go out, there's always options to choose for leaner meats, such as fish or chicken. And again, for low fat, consider things that are grilled versus fried. And then also consider choosing menu items that have more vegetables and fruits. Not to say you can't have any meat, you can. Maybe select more of the things that are in the salad section or that would offer the option of adding more vegetables, or the menu item itself already has a lot of vegetables. Those are good options. And then also another thing you can consider is asking the waiter or waitress to make a note for the cooks to not add any salt if possible. Not to say that everyone can. Sometimes they really can't, but it doesn't hurt to ask. Another thing to consider is maybe asking for the sauces on the side, because sauces tend to have more of the salt. And so if you were to ask for the sauce on the side, you can control how much of the salt you're putting into your food.
That's great advice. And I think it's great now we have the internet. You can look up a menu online and maybe get some information in advance about what you want to order. This is just very, very helpful. So just want to remind our audience again that you can submit your questions now. We're still gathering questions, and we'll be ready in a few minutes to answer those. You can just drop those in the comment box, and we will get to those soon. So physical activity. A lot of people have questions about, movement, exercise. What are you supposed to do? We all know exercise is good for you for managing high blood pressure, but how much physical activity should people aim to have, Dr. Hall, when they have stage 3 kidney disease? Any tips for starting a routine?
Yeah, I would say that, the studies have shown that 30 minutes at least of physical activity, and this is, defined as aerobic activity, so something that essentially gets your heart rate up and gets you breathing to a point where it's slightly uncomfortable to talk. And so my favorite, again, is walking. But really, you should feel free to engage in a combination of physical activities. I often encourage people to exercise with friends, with family. It really is something, though, that you should be that should be enjoyable to you and readily accessible to you. And it can be as simple as, walking the dog every day for 30 minutes. And you can also divide up your physical activity. You don't need to do 30 minutes all at one time. You can do 15 minutes here and 15 minutes there. But it's been shown in multiple studies to reduce your risk of heart attack, of strokes, and it will also reduce your blood pressure.
Thank you. So, transitioning a little bit into eating again, behavior change is hard. Shedding those, habits that aren't so great for us is really difficult, and adapting new ones. Ms. Wong, do you have any tips to help people looking to start a healthy an eating routine or eating well with kidney disease at stage 3?
Yeah, I think the good first step to take is to talk to your doctor and or your dietitian if you already have one. If not, you can ask for one because they will be the ones who know specifically what your needs are and what to focus on. And then I think also in general, it doesn't hurt to start leaning more towards the fruits and vegetables because they are lower in fat and lower in salt, so that it's a healthier eating habit to also help lower your blood pressure. I think one thing I usually encourage people to start with is consider your plate or your bowl. Every time you eat, try to have at least half of that meal be fruits and or vegetables. I think it's just a good state of mind to have whenever you approach food or your meals in a given day. That way you're making sure you're incorporating the fruits and vegetables and the lower fats and lower sugars and salt.
Okay, thank you. So we've been getting a lot of questions coming in, and I see them in the chat. So I will now transition to our audience questions. So here's one, really, it's a good one to start off. And this does come from our audience. So when should someone who's been diagnosed with kidney disease first see their nephrologist? And I think that could go to you, Dr. Hall, but I think it's a good question for you too, Ms. Wong, about when should a patient start seeing a dietitian? So I'll start with you, Dr. Hall. When should a patient first see their nephrologist?
Sure. So, as we mentioned, 1 in 7 American adults have chronic kidney disease. And so the vast majority of people with chronic kidney disease probably do not need to see a kidney specialist. The 2 most common causes of chronic kidney disease are diabetes mellitus and hypertension. And these are conditions which most primary care providers are very, very good at managing. And so I would say most people who need to see a kidney specialist or a kidney care team probably have more advanced kidney disease or have some laboratory abnormalities such as a high level of protein in their urine, or their kidney function is dropping quite dramatically. Those are the folks who I would recommend perhaps inquiring with their care team about specialist referral. Specifically people with stage 3B, for example, or really stage 4, stage 5 disease, or with high levels of protein in their urine and or rapidly declining kidney function. I think those folks would probably benefit from having a kidney care specialist involved in their care.
Thank you. And so, Ms. Wong, what about starting to work with a dietitian when you have kidney disease? What stage would be the best time?
Yeah, so I think, and also a lot of studies have shown that it's best to work with a dietitian as early as you can because of that piece with how effective diet management is to prolong the progression of kidney disease. So the earlier stages you're at, definitely reach out to your doctor to see if you can see a renal dietitian or even just a regular dietitian, to start talking about the foods. Also, as Dr. Hall mentioned, oftentimes kidney disease isn't caught until it's later stage. Therefore, when you go to your annual physicals, if there's anything that's brought up, especially if you already have diabetes, that's also a good place to consider checking in with a dietitian.
Thank you. So looking at the questions, there are a couple that relate to how long between stages. So one is, how many years are you likely to stay at a particular stage of kidney disease? And is there an estimate about how long it takes to progress among the stages from stage 3A to stage 5? And just to follow up, and I'll remind you the questions too, does everyone necessarily progress to kidney failure?
Yeah, it's a great question, and fortunately, the vast majority of people with chronic kidney disease do not progress to end-stage kidney disease. As I mentioned, the 37 million Americans who are estimated to have chronic kidney disease, but at any given time, there's probably only about 550 to maybe 600,000 people in the United States who receive what we call maintenance dialysis, and then maybe another 150,000 who are living with a functional kidney transplant. And so there's a big drop off from 37 million to less than 1 million people who have end-stage kidney disease. And so fortunately, the vast majority of people with chronic kidney disease will never reach end-stage kidney disease. And most people, though, with chronic kidney disease have risk factors such as hypertension and diabetes that place them at high risk for cardiovascular events such as heart attack, as well as other events such as stroke. And so this is one of the reasons why this sort of multi-dimensional foundational approach to health works very well in patients with hypertension, chronic kidney disease. The exercise, the attention to diet, to optimal weight, and then avoiding any potential medications or supplements that could potentially harm the kidneys.
And what kind of tests are run typically to diagnose kidney disease?
Yeah, and so the most common test is going to be a blood test, which is the serum creatinine. It's probably one of the most common blood tests that we get in medicine. It's widely available at almost all of the medical clinics. And as I mentioned, it's a measure of really muscle breakdown and the kidney's ability to excrete that breakdown product of muscle. And so as the serum creatinine rises, it's usually an indicator that the kidneys are not functioning as well as, sort of not functioning normally. So that would be the most common test that people would get. Other tests that they would get, some people have heard of the blood urea nitrogen or BUN or BUN, which is a breakdown product of protein. It will also commonly go up in conjunction with the serum creatinine concentration or level. Also another sort of indicator of potential kidney dysfunction. The amount of protein in your urine, either through what we call a dipstick or through quantitative assessment of the amount of protein in the urine, is another common test. And then more uncommon tests probably are like a kidney ultrasound to ensure that there is nothing structurally obstructing, for example, the kidneys, like a kidney stone or narrowing in the ureters, which are sort of like the hose-like apparatus which drain the kidneys to the bladder. And then very rarely will people proceed to get a kidney biopsy, which is actually a piece of the kidney where we look at it under the microscope using a number of special stains.
Thank you. So, you were just talking about testing and EGFR, and this actually came up in our session about eating with the cooking doc too. And I'll direct this to you, Ms. Wong. What food should I eat to improve my EGFR?
Well, a lot of the things that we mentioned earlier in the session can help. So making sure that like, for example, blood pressure or diabetes, making sure those are under control. So you're eating to manage those things, blood pressure and or diabetes will help. So things like lower salt, lower fat, lower added salt, sugar, and then the positives would be leaning more towards lean meats, and the fruits and vegetables will help. Another thing, another thing you can consider, as it sounds like you're trying to be more mindful with your eating. One way is, I know the AKF has the Kidney Kitchen, where you can scroll through different recipes and suggestions based on various diets that you're considering or are interested in. For example, lower fat. You can probably scroll through that and see examples of recipes that you can try.
Yeah, that's absolutely true. And thank you for mentioning that. On kidneykitchen.org, we have a lot of information about foods that are, let's say, high in potassium or high in phosphorus, things about protein, eating with your stage. So we have information about what you should be eating at stage 3 kidney disease and a lot of helpful resources. Dr. Hall, did you want to comment at all on what foods I should eat to improve my EGFR?
Yeah, it's a great question. I usually tell my patients, generally speaking, when they approach a grocery store, to shop on the peripheries, because that's essentially where all your fresh fruits, your fresh vegetables, your fresh meat section, and then your fish sections are located. And to the extent possible, kind of avoid the middle aisles, which is generally speaking where all your packaged and processed foods are located. So the can, the boxing, the freezing, the processing of all of that typically requires additives, including salt. Nowadays, most Americans, their diets, generally speaking, the salt content comes not from what they add in the cooking process or what they add at the dinner table, but what is already added for them by the food industry. And so, the best advice I usually give to my patients, or the general advice I usually give to my patients before sending them on to more expert advice from people like Kathy, is to shop really on the peripheries of the grocery stores for that fresh food and fresh vegetables, and really try to make their make their own food from scratch where possible.
Thank you. So getting specifically into blood pressure, here's a question from someone in the audience. It says, if you're suspected of having stage 1 hypertension, should you take your blood pressure daily and provide the data to your doctor, or just a few days a week and provide that data to the doctor? What should someone do? How much should they monitor depending on stage? And this one specifically about stage 1.
Yeah, it's a great question. And, the guidelines now are recommending what we call out-of-office blood pressures. And so measuring your home blood pressure at home and then sending those values to your care team is an outstanding way to sort of participate in your care. I usually recommend, measure their blood pressure several times a week, typically at the same time of day, I usually teach them kind of the proper way to measure blood pressure, which is seated with their back supported, feet flat on the ground, not having ingested any caffeine within, the last 30, 40 minutes or so. And then making sure, I like the upper arm blood pressure cuff, making sure that the cuff is at the level of the chest and really at the level of the heart. And I usually recommend to take the first reading and kind of ignore that, and then look at the second reading. And if it differs substantially from the first reading, maybe even take one more to ensure that you're getting an accurate reading. And then to write those down or record those, in a smartphone, for example, or in your computer for those who use them, and then transmit those periodically to their care team.
Thank you. So again, with blood pressure, Ms. Wong, you had introduced us to eating with kidney disease and talked about the DASH diet. So if someone has high blood pressure and they're diagnosed with kidney disease, is the diet the same? Is there, a way to have to modify, let's say, what you eat to address high blood pressure and somehow integrate that into what you have to consider when you have kidney disease? And how does a dietitian help someone do that?
That's a good question, because there's so many diets out there for different disease states. I think with hypertension or high blood pressure and kidney disease, though the diet does come hand in hand, it's not as complicated as other ones. And so by following the low fat, low salt, definitely low salt recommendation will help. Specifically though, for like detailed recommendations on what types of food to have and not to have, that will depend on your kidney disease, how well your kidney is able to filter out certain things. One thing I had mentioned early on is, for example, some people that are in later stages of kidney disease, their kidneys might not be able to process potassium as much or phosphorus as much. So those people may need to have more specific recommendations to limit some high potassium or high phosphorus foods. Mm-hmm. And that person might be different from someone with hypertension and kidney disease, but in an early stage of kidney disease, because with earlier stages of kidney disease, their kidneys are still able to process some of those things, so they might not have the same recommendation. So all in all, it's best to talk to your doctor or your dietitian for specific recommendations, because they will have the data, meaning your lab values, to know exactly what to recommend for you.
Thank you. So looking at some more questions, here's a question about intermittent fasting. And I'll start with you, Dr. Hall. Let's see. Is intermittent fasting safe for people in stage 3 CKD?
Well, it's a great question. And I will say that the answer is probably not as great as the question. I'm not aware, to be honest with you, of any large, what we call randomized controlled studies comparing randomized fasting to like sort of standard eating in terms of their outcome or those outcomes on either blood pressure control or progression of chronic kidney disease. I will say, though, that weight loss or maintaining optimal weight is one of the foundational approaches to managing blood pressure and what I would consider earlier stages of chronic kidney disease, as well as diabetes. And so at times, people may need to fast for periods of time. But again, I would say this is something that you probably do want to talk with, somebody like Kathy about, or your primary care team about. Intermittent fasting can mean a lot of different things to different people, and so I think details are probably important here as well too.
Ms. Wong, what would you say about intermittent fasting and CKD3? Is it safe?
So, again, like Dr. Hall mentioned, there are no direct, or I'm not aware of any direct correlation to the effectiveness of intermittent fasting and specifically CKD. So I would also suggest to talk to your dietitian or your doctor if you are considering that. Also specifically because different people interpret that differently. Some people interpret intermittent fasting as just not eating a certain time of the day. Other people interpret it much differently. And so the specifics on how you think of intermittent fasting is something that it's also important to tell your doctor or your dietitian.
Thank you. So I think we have time for maybe one more question, maybe two, but a couple of things came up about coffee. So is coffee safe for someone with CKD and hypertension? And then the other question about coffee was, what kind of coffee creamer do you recommend? Let's see. I'll start with you, Dr. Hall.
Okay. You're right that we do recommend probably people to not drink caffeinated beverages before taking their blood pressure. And it's interesting because I don't think there's a consistent relationship with caffeine intake and with blood pressure. There are some people who seem very, very sensitive to caffeinated beverages, including coffee, and whose blood pressure probably does increase with intermittent usage. But there's a large, I think, body of evidence to suggest that, regular ingestion of coffee, for example, probably doesn't impact blood pressure as much as I think we read about. And so I think it really depends on the individual. I think, you can obviously test this on your own if you have a blood pressure monitor at home and see how the caffeinated beverages or coffee impact you. I think the other thing to note, though, is that there is, there's a lot of decaffeinated products too. And so if you do find that the caffeinated drinks, or in particular coffee, impact your blood pressure adversely, there's always the option of switching to decaffeinated coffee or decaffeinated products, which I sometimes recommend for the small number of folks in my practice who do seem to have blood pressure spikes with their coffee or with their caffeine.
Okay, and Ms. Wong, what do you say? We have a couple minutes.
So it's not a hard no. Coffee, you can drink it, but be mindful of the effects on your blood pressure. So like what Dr. Hall said, if you notice that you are amongst those people that are affected by caffeine, more sensitive to caffeine, then consider decaffeinated beverages. In terms of creamer, be mindful of the saturated fat. So one thing you can consider is maybe the lower fat options. So you can even consider like soy milk, rice milk, any plant alternatives you can add to, if you like, to your coffee. And then if you don't particularly like those things, then you can consider adding less creamer into your coffee, because sometimes some people add this much creamer and this much coffee. So maybe bump it down to this much and this much coffee. Some things to consider.
Thank you. And one point that I thought was that you made, Dr. Hall, and also you, Kathy, is that it isn't just coffee, but it's the caffeinated beverages. So many things have caffeine. How do you know what has caffeine and what doesn't?
Oh yeah, I think this is getting back to what Kathy emphasized earlier in the session, which is really become familiar with your labels. And caffeine's, generally speaking, indicated on the labeling, and also how much caffeine per serving size. And so I think be very conscious of what you're ingesting, and one of the first ways to do that is basically to take a look at the label and the serving size and how many servings you're having.
And we have just a moment left over. Would you like to comment on that, Ms. Wong, about how we know what's caffeinated and what isn't?
Well, just on the top of my head, I can think of is tea, coffee. A lot of the energy drinks tend to have anything that people tend to gravitate towards for energy tend to have caffeine. And just as Dr. Hall mentioned, being familiar with your nutrition facts labels, because on the ingredient section, you can oftentimes see it listed if it's an additive. And I feel like for the most part, people tend to have an idea what generally contains caffeine.
All right, thank you. Well, I wish we had more time for the other questions, but I want to thank you both so much, Dr. Hall, Ms. Wong, for sharing your insights on high blood pressure and stage 3 kidney disease. As I mentioned, we get a lot of audience questions about that, and so just you being here, being able to provide answers to that was just very valuable to us. So I just want to thank you again and can't wait to invite you to other education events in the future. So before we sign off for today, I just want to give a special thanks to our audience members for participating in Kidney Action Week. We still have a few more days left, so and we also have another session starting at 4 p.m. Eastern Time. And here you'll hear about kidney health advocates, about life with in-center dialysis. So I hope you'll be able to tune in. Again, follow us on Facebook and through kidneyfund.org for more information and the full agenda for Kidney Action Week. Thank you again for joining us.